HIV-related stigma remains a major impediment to the HIV response in Kenya. In April 2022, the International AIDS Society (IAS), in partnership with the National Empowerment Network of People Living with HIV/AIDS in Kenya, NEPHAK, and Partners for Health and Development in Africa (PHDA), held a stakeholder engagement workshop in Nairobi, Kenya. The workshop aimed at disseminating the findings of a study conducted in Kenya, exploring the influence of stigma and discrimination on HIV prevention, treatment and care for Kenyan people living and affected by HIV, and with a focus on intersectional stigma. The participants included stakeholders from civil society, policy, and program implementers. Pascal Macharia from HOIMUS and PHDA presented the study's findings.
To stress on the fear part, I think fear actually shapes all the other consequences of stigma, especially for persons living with HIV and for key populations. The intersecting factors actually compound all the consequences, because one is dealing with stigma as a gay person, stigma as a male sex worker, and then again stigma as a PL-HIV. So I think this is part of what we like to call a triple dose of stigma, because all this, you actually have to deal with all this before you actually can access care.
Peter Odenyo from NEPHAK presented on the latest Stigma Index findings, which sought to track the evolution of stigma in Kenya and shared recommendations on the best way to address stigma in various communities. Some of the participants shared their journey navigating stigma.
When you are tested at the facility, and they tell you that you go to the laboratory and have this test done, or go to the VCT and get your results. It's very easy writing that. But how many clinicians, how many have gone through the test? Not many. Because they are scared of the stigma. They are scared of what people are going to say.
Stigma is real, and it is within our community. I am a sex worker who is living with HIV for the last 20 years. When I was tested for HIV in the year 2002, that was the whole turn of event. I ran away from my own children because I thought they knew or they saw the HIV in me. My own sister told me, "Don't come back to my house."
After the tea break, a panel discussion brought together speakers to discuss barriers and solutions to address and reduce HIV-related stigma. The panel discussed and made commitments towards addressing internal stigma within the community and within the healthcare system, effectively measuring stigma and discrimination, providing additional resources to scale up stigma reduction interventions, and changing the policy environment to prevent stigma.
Communities or KP-led organizations can also do a lot of things to ensure that this stigma, we fight this stigma or we reduce it. We can empower, or we can just empower communities, give them the right knowledge, give them, that empowerment of knowing what is stigma, knowing why it is wrong to stigmatize, and even teaching and sensitizing our people on their human rights in case there is any offense in terms of stigma and discrimination. People are able to report. And also, as organizations, we have a responsibility to ensure that we create a safe environment and put up good structures to ensure that our people feel safe reporting. Remember, even outside there are ways and means of reporting, but you find that our people will shy away from reporting cases to the police simply because they will also be stigmatized at the police.
We have to now measure, the issues that affect access to services, and stigma and discrimination is one of them.
We need to take into account the general cycle around ignorance, fear, that leads to stigma, that leads to discrimination, that results into human rights violations, and ask ourselves at each of those cycles, the point of ignorance, what are we doing to address it? The point of fear, what are we doing to address it? The point of discrimination, the point of human rights violations, what are some of the issues we are then putting into place.
The panelists also shared their thoughts and ways to ensure a more meaningful involvement and representation of key populations and underrepresented groups within stigma research to address HIV-related stigma.
The benefit of the meaningful involvement of key population in research is because it has the trust of the key population. There is nothing that doesn't identify with us that we trust. Remember, we are in a community and a society that segregates us. So anything that comes from, we do consider anything that is not ours coming from outside. And so I would give an example of the You to You campaign that is currently being held in Kenya. In as much as other populations of people living with HIV are doing the campaigns, the key populations are also at the center of it, doing the campaigns for the key population. We are a diverse group, the transgender people, the MSM, the PWID, even the campaign messages are very different because they're targeting very different people. Meaningful involvement, it means that we are involved from the word go to the word end, because it is our thing, so that when it comes here, I'm able to confidently own it, that it is indeed true that sex workers in Nairobi face this and don't face that.